This is the News at 4.
Welcome to the News at 4. I'm Morgan Romero. It feels like Groundhog Day. Again, much of southern Idaho is back under crisis standards of care. The Department of Health and Welfare activated crisis standards because of severe staffing as well as blood shortages. Andrew Bartline spoke with a local health district as well as the Red Cross about this dire situation they're facing. Andrew, what can you tell us?
Well, Morgan, we reached out to all three public health districts that are reverting back into crisis standards of care. We heard back from the South Central Public Health District. We have a map that shows where these regions are in the southwest portion of the state. It's going to include the Southwest District Health and Central District Health. Right now, South Central, the one we spoke with, that's the Magic Valley area. They say they're doing okay. While crisis standards of care is activated, that does not mean that these standards will necessarily be used by their hospitals. But South Central adds the 5 hospital systems in their region have communicated they are on the verge of needing to. The overarching limitation between all these hospitals is a staffing shortage.
At this point in time, the big thing that we're seeing right now is that we have no ICU beds available and we only have a few med-surg beds available. And then, of course, there's also a concern that if we run out of space in our hospitals, it will be very difficult to find other hospitals that can take on those patients.
It's important to note that ICU capacity is fluid. It does change constantly, but right now that's the state in South Central. It is full. The second problem here, the blood shortage. Since the pandemic began nearly 2 years ago, the American Red Cross says their donations are down 10% nationwide, and it's leading to the worst blood shortage in more than a decade.
It's putting hospitals in a difficult situation. They're having to make difficult decisions that they don't want to be making.
What do some of those decisions look like?
You know, when the demand is greater than the resources, some treatments may have to be delayed. You know, they're going to have to decide who gets blood and who may have to wait for blood, and that's a difficult situation. And
The Red Cross says January is a difficult time of year to collect blood donations, even in normal times due to flu season, cold season. But these staffing shortages hit them too, and it's making it difficult for the Red Cross to collect the blood that is needed. It's important to also note that we reached out to the Idaho Department of Health and Welfare and St. Alphonsus. St. Alphonsus is the hospital system that requested an activation of crisis standards of care. Both Health and Welfare and St. Alphonsus tell us to wait until tomorrow. We'll have that Health and Welfare media briefing, where weekly has traditionally been a time that they answer all of those questions, public health questions, over the past week. Morgan?
Yeah, Andrew, we will get more information tomorrow, and thank you for staying on top of this for us.